I don't know, 1,000 of these a year probably. It's a pretty common thing to have happen. Typically, they'll make a couple of the surgeons will see him in the morning and talk to you guys about that. It's, you know, surgery takes maybe 30 minutes to 45 minutes. They kind of use, it's all done kind of minimally invasively nowadays with maybe 3 incisions about this big. And a rod goes inside that femur bone, and then there's a kind of a bolt that goes through, kind of through a hole in the rod, and it goes through that piece that's fractured and kind of lines it up. We line it up and screw that into the pelvis, and that kind of secures the hip joint so it doesn't move. So that bone has to line up good so it'll heal. And metal holds that in place. That's the standard way that they treat it. So what we'll probably do tonight is get him tucked in and have the surgeon see you guys and talk to you about it in the morning, exactly what you want to do. So they usually come around between 6:30 and 7:30 in the morning, and then they do their surgeries. So that's when they round on patients, and then they're all trauma stuff all the stuff I'm going to give them tonight that comes in, you know, so then they kind of go and do their cases.
Okay, then he may have surgery tomorrow.
Possibly so. He's going to need some evaluation, obviously, you know, they're going to need to make sure he's safe to undergo surgery. And that's if, you know, I assume someone's a power of attorney. Are you a wife?
We're
Are you a power of attorney?
We're part of too.
If that's what you want to do, I mean, you know, the decision to have surgery is kind of up to you guys. He won't ever put weight on that leg if he doesn't, though, because it won't heal.
Does it matter that it's been like
Been
3
a week?
weeks?
Has it been 3
3
weeks, you
weeks.
think?
That's how long it's been, how long it takes to.
Well, that might make it might take a little longer in surgery, but
His
the
condition.
trauma guys are really, really good. If I ever had something broken,
How long does it
it's
take
Dr.
to
Gertzen
heal?
or Dr. Heisler, it's one of those two surgeons that'll be seeing you in the morning, and they're the best, just the best. They're really, really awesome. So, yeah, there's probably some scar tissue and some blood clot and stuff in there from the fracture. When the bone fracture, it bleeds, so he'll have a little bit of hematoma in there. But they should still, typically it's done with x-rays and lining everything up, and usually not any big incisions to my knowledge. Now, sometimes if they feel like it's been too long and the ball has not had a good blood supply long enough, then they would do what's called a hemiarthroplasty, which is kind of half of a total hip. So meaning they put a ball and stem in the femur, and it lines up with the cup. And then, so that might be one of the things they have to do. That. That's a bigger incision, obviously.
How far apart did you say it was?
Well, there's some separation in there, and it's hard to really tell exactly by the x-ray because sometimes it's magnified and so forth. But there's a gap there. It's not, in other words, it's not like a crack. There's definitely, it's not lined up.
It's pretty clear, in other
Yeah,
words.
we call it displaced. It's not the fracture where the ball is not, it's not lined up. It's kind of a little bit, so they have to.
What's recovery?
Well, that depends on the procedure they have to do typically, but it's usually about 6 weeks. If it's that hemiarthroplasty, it's faster because we're not asking that bone to heal back.
Right.
So that's probably a quicker thing. We just have to watch his wound because bigger risk to get an infection there.
I thought with his knees, he probably wouldn't be walking anyway, would he? I mean.
But just
his-
even to pivot, just to get up in the bathroom and
Yeah,
he
he
can't.
hasn't really walked for a while, I don't know. But now,
Does he have
see,
Alzheimer's or
yes.
something like that? I assume, I don't throw that out there, but I
Yeah.
assume that there is some issue with that.
Type of dementia, I mean that.
And the anesthesia, how heavy is that?
Well, they'd have to put him out for it for sure. But, before he would undergo any kind of surgery, is he on blood thinners or anything like that you know of? Okay. he would need a pretty full workup to make sure he would be medically stable. So they'll check EKGs and lab work and make sure all his chemistries and things like that are in normal ranges and so forth.
How long is he in after surgery?
He'll probably be here for 3 days. It's usually 2 or 3 days, and then back here. I assume he's in a nursing facility. And then he could go back there after that. Most nursing facilities take hip patients
Okay.
that are just, if you and I had a total hip replacement, some of us go to rehab, a nursing facility for a week or two, and so people are usually set up to treat that sort of thing. This is a little different story because of his ability to participate.
Right, right.
So